All right, guys, welcome back to Underground Science. In this video, we'll be talking about chronic granulomatous disease. Okay, so let's go and get started. First things first, though, we have to talk about how neutrophils and macrophages, right, form reactive oxygen species. Neutrophils, most importantly, because they do more oxygen-dependent killing than macrophages. So we have oxygen, right, in our bodies. So our neutrophils can take that oxygen and convert it to superoxide, which is this molecule right here. That first phase is called the oxidative burst phase. And we need an enzyme to do that. Your neutrophils need an enzyme to convert oxygen to superoxide, and that enzyme is NADPH oxidase. Now, this enzyme, NADPH oxidase, is actually on the membrane of the phagosome. Okay, so remember, if there's a pathogen out here and your neutrophil sees it, it's going to try to phagocytose this pathogen, okay, and it's going to take it in and form a phagosome, okay, inside it. So we're going to have our neutrophil, phagosome, and then pathogen. Then we know that it's going to try to do the oxidative burst phase and so on and form our reactive oxygen species to destroy this pathogen. So the NADPH oxidase enzyme that converts what? Oxygen to superoxide is on the phagosome cell membrane. Okay, so I just wanted to state that so we can commit that to memory too. All right, but so that's the first step, right? So now we have superoxide. Then we can take the superoxide and convert that to hydrogen peroxide. And you need an enzyme to do that too, and we use superoxide dismutase to do that. Once you have hydrogen peroxide, your neutrophils convert that to bleach or hypochlorous acid via the enzyme myeloperoxidase. Okay, so these steps are really important in understanding chronic granulomatous disease, specifically this step where NADPH takes oxygen and converts it to superoxide. Okay, it's actually this enzyme that's defective in chronic granulomatous disease. So what does that mean then? If this enzyme is defective, then you can never take oxygen and convert that to superoxide. Therefore, you can't take superoxide and convert it eventually to bleach, right? Through the conversion of hydrogen peroxide first, then to bleach. So if you can't do this step, right? If you can't do this step, then the steps downstream will not be able to occur either. Okay, which means you can't form bleach, which is the main reactive oxygen species that we use to destroy the pathogen that the neutrophil phagocytosed. Okay, so that's defective in chronic granulomatous disease. And of course, if you can't do that, we just said you can't destroy pathogens properly, which means you're going to have increased infections. So, what types of organisms, right, what types of organisms can affect patients with chronic granulomatous disease? So, we have to remember the enzyme catalase. Okay, let's talk about this for a minute. So, remember, we have the enzyme catalase, right? Catalase, remember, right, in simple terms, it did what? It degraded hydrogen peroxide, right? Normally, bacteria have hydrogen peroxide and produce that. So when they produce the hydrogen peroxide, what we do is we can take that hydrogen peroxide that the bacteria is already producing, and we can convert that straight to bleach, right? And then remember what enzyme we use to do this is myeloperoxidase. So we can do that normally, right? But in people who have chronic granulomatous disease, right, this step will be affected. Now, why will it be affected? Well, because you can't convert oxygen to superoxide, right? So then you can't ever make hydrogen peroxide and you can't ever make bleach. So in people with chronic granulomatous disease, if you get a catalase positive organism, right, then you won't have any hydrogen peroxide in order to convert that to bleach. Okay. Because if you have a catalase positive bacteria, for example, or an organism or pathogen, that pathogen, yes, they will produce hydrogen peroxide, but because they're catalase positive, they're going to destroy their own hydrogen peroxide that they produce. So then people with chronic granulomatous disease, they cannot take that hydrogen peroxide and convert it to bleach because that's going to be their only source of hydrogen peroxide is what the bacteria is producing because they can't produce their own hydrogen peroxide. Remember, you need to convert oxygen to superoxide and superoxide to hydrogen peroxide, right? But you can't even do this step if you have chronic granulomatous disease. So how are you going to get your own hydrogen peroxide? So the only way to get hydrogen peroxide in these patients is the bacteria that will produce its own hydrogen peroxide. Okay, but if the bacteria is catalase positive, yes, it will produce its own hydrogen peroxide, but it's also going to degrade its own hydrogen peroxide. All right. So that's why these patients with chronic granulomatous disease are more susceptible to catalase positive organisms. Okay, susceptible to infections due to catalase positive organisms. All right. So what types of organisms are these? So the first organism we should know, right, is Staph aureus, right? Staph aureus is an organism that's catalase positive, and that can lead to this can Staph aureus can infect, right, lead to infection in terms of chronic granulomatous disease patients, right? You have an increased susceptibility of infections caused by Staph aureus in these patients. Now, remember, Staph aureus, some of the things it can do is it can cause skin abscesses, right? And it can lead to, you can also have bone infections, so osteomyelitis also is something important to keep in mind. And Staph aureus could also cause pneumonia, right? And so on. So that's Staph aureus. Another organism that's catalase positive that we have to know that can um, infect people with chronic granulomatous disease is nocardia. Okay, nocardia is actually a organism, right? A pathogen that can cause abscesses. Okay, specifically, it can cause lung abscesses, right? And it can even cause brain abscesses too. So lung and brain abscesses for nocardia. Next organism, Aspergillus. Okay, Aspergillus. This is a fungus, right? As we know, and people with chronic granulomatous disease again are at an increased susceptibility of getting Aspergillus infections. Why? Because Aspergillus is catalase positive, which means Aspergillus will degrade its own hydrogen peroxide. So then chronic granulomatous disease patients cannot have hydrogen peroxide and cannot convert hydrogen peroxide because there's not any there, right? And it can't convert hydrogen peroxide to bleach. Okay, so it can't destroy Aspergillus properly along with other catalase positive organisms. Aspergillus, as we know, can lead to pulmonary aspergillosis. Okay, so that's important to know. And of course, it can also lead to granuloma formation too. All right. Next organism that's catalase positive that we should know in terms of chronic granulomatous disease is Pseudomonas. So Pseudomonas, as we know, Pseudomonas can cause pneumonia, right? Cause pneumonia. It can also infect your bones, causing osteomyelitis. And of course, it can also cause wound infections, has a grape-like odor, right? Things like that. But that's four pathogens so far. Another pathogen that we should know that's um, catalase positive, and it's important to talk about in terms of chronic granulomatous disease is Serratia. Okay, specifically Serratia marcescens. So Serratia marcescens can also infect your bones, right? So that can lead to osteomyelitis. So you see that bone pain and fever, right? If it spreads to your blood. And then, of course, it can lead to serratia can also cause pneumonia too, right? So that's important to know. Another organism that we should know is called Burkholderia cepaciae. Okay, so we're gonna have Burkholderia. Zepaceae. Now, this organism, again, can cause pneumonia in these patients, and it can also, I mean, cause sepsis too. That's a possibility too. And then another organism that we should know, right? It's just important to have these organisms in your memory, right? So in case you see it as a question in the question stem in your exams. So Candida is also an organism that's catalase positive. Of course, it's a fungus, and we know Candida can cause oral thrush, right? Even E. coli is an organism we should know relating to this disease, right? Remember E. coli? This can, as we know, cause UTIs, right? And then another organism that we could keep in mind, it may not be that common, but we can also keep in mind of Listeria, okay? Listeria can also be important when talking about increased susceptibility of infections and chronic granulomatous disease, okay? Now, in the name, right, it's called chronic granulomatous disease. So you get granuloma formation, right? So as we said, um, if we talk about macrophages, right, when they try to phagocytose these bacteria, try to destroy it, right, they can't destroy it properly because they don't have proper reactive oxygen species productions due to defective NADPH oxidase. So if you can't clear the bacteria, this can lead to chronic inflammation, right? The bacteria is not able to be cleared, so that can lead to chronic inflammation and granuloma formation. And the bacteria and the macrophages do this. Okay, so remember granulomas, macrophages are really important for that. And they're just going to basically surround. So these are the macrophages that will surround whatever infection, right, or the trapped bacteria. Whatever trapped bacteria is there, whatever bacteria is there, the macrophages will try to wall it off and wall off the trapped bacteria so they can contain the infection. And of course, we know that another part of granulomas are epithelial histiocytes and also giant cells. So things like that will come in. T cells, right? We know that that's part of the granuloma also. So the T cells can also come in and help surround whatever infection is occurring. Okay, just to contain it. Okay, so because remember, right, in a granuloma, if Th1 cells, right, the Th1 subtype of CD4 cells can become activated, and what they do is they release interferon gamma, right? They release interferon gamma, and we know that interferon gamma will recruit more macrophages to this area, right? More macrophages, and it can help formation of epithelial histiocytes and giant cells, right? Because what can happen is all of these macrophages, right, that are coming to the area can start fusing together and forming giant cells, okay, which are basically if the macrophages fuse together, they can create multinucleated giant cells, which can surround the infection, and then these T cells can come in and also surround the infection, right, contributing to the granuloma, and so will these epithelial histiocytes too, okay. And these granulomas, of course, we know if granulomas deposit into organs, that can damage the organs. So granulomas can deposit into the lungs, the liver, the GI tract, the skin, right? So where can these granulomas deposit? The lungs, the liver, GI tract, skin, right? Basically deposit into organs and lead to organ damage. Okay, so even organs of the urinary system, right? So, and they're going to obstruct the normal organ function if they do deposit there, right? Whichever organ they deposit in, they're going to obstruct that normal organ function and even lead to organ damage. All right, so that's basically the main thing to talk about for chronic granulomatous disease. All right, so again, if we review this, we said what would happen? You would get recurrent infections because you can't destroy pathogens properly because you don't have functioning reactive oxygen species production due to defective NADPH oxidase. That's going to lead to chronic inflammation, activation of Th1 subtype T cells, right? Which will lead to epithelial histiocyte formation, giant cell formation, macrophage recruitment, which and T cells will try to wall off the infection, forming granulomas in organs such as your lungs, liver, skin, GI tract, genitourinary system, and so on, which can lead to obstruction of normal organ function and organ damage. Okay. So again, we listed that here too, and we talked about these sites of infections also in the previous slide. The last thing to talk about for chronic granulomatous disease is the diagnosis. So when talking about the diagnosis for chronic granulomatous disease, we have to focus on the nitro blue tetrazolium test. Now, what is this test testing, right? It's testing the first step of our reactive oxygen species pathway, which is the oxidative burst step, where we took oxygen and we converted that to superoxide via NADPH oxidase, remember? So if this step works, right? If this step works, then we know that our NADPH oxidase is functional. So if we are able to form superoxide, that would mean we have functional NADPH oxidase. And in this test, we would see the blue color, right? But if this NADPH oxidase is dysfunctional or does not function like we would see in chronic granulomatous disease, you will never form superoxide. Therefore, the solution will remain colorless, right? We will have a colorless solution if the NADPH oxidase doesn't work, because you can never form the superoxide if this enzyme does not work. So if it does work in the nitro blue tetrazolium test, you will see the blue color. But if it doesn't work, then you will see no color, right? You'll see a colorless solution if the NADPH oxidase does not work. Okay, so that's the main thing to know about the nitro-blue tetrazolium test. And also that's basically concludes this video and concludes talking about the main things about chronic granulomatous disease. All right, so I hope this video was helpful. I hope it wasn't like too confusing or anything. Thanks for watching and see you guys in my future videos.